Hello, my name is Jungmin An and I practice East Asian medicine in Washington State. I have been practicing acupuncture with my focus on pain relief for 12 years. You will learn about body's interconnection and where to apply the pain relief tools. Benefits of this method are you can do it by yourself, everywhere and anytime. It provides immediate relief and is indirect and safe. Let me give you an example how you can redirect energy even without touching the pain's location. For example, when you have a pain and inflammation, your heart needs to overwork and become tense. You can check by pressing the yellow dot area, which is your heart. The more you feel tender, it tells how much your heart is stressed. There is a heart equivalent acupressure point in the upper forearm. If you press with your thumb, you can check the tender points around the green dot area on your left arm and find the tender points. Once you find the tender points, and apply the acupressure for a second. Then check your yellow dot area again. Most people experience immediate pain relief from tension. Here is a forearm back chart. Please use the skeleton as a reference. So green color is representing cervical spine, blue as a thoracic spine, yellow as lumbar spine, and orange as sacrum. Neck is around 20% of the forearm, middle back 40%, lower back 25%, and sacrum 15%. You can use this portion to find the tender points relating with your pain's location. For example, if you have pain on the neck, press red mark area to find the tender points on your forearm. And once you find it, and then doing the acupressure on the tender point, and you check your neck again. With the right pressure and location, you may feel the immediate pain relief. Here is a forearm front chart. This represents your chest and abdomen. People with neck pain are more likely to have tension on the SCM muscle. It's in the middle picture. This time, move your neck and check what direction you cannot move or have limitation to move. And find the tender points around the green dot area. With the pressure and move your neck once you find it. If you find the tender points making your neck movement more flexible, you can apply the acupressure there longer. Did you feel difference? If yes, that's great. If not, there might be another muscle is involved or not enough pressure. But after you master this method, you will know how to relieve pain properly. Hand chart. The back of your hand represents the back of your body. Red checkmark area is your neck, and squeeze there and stimulating the nape area. If you squeeze on the purple marks area, it can relieve tension on the upper back area and scapular area. The front side of your hand represents the front side of your body. When you have a jaw pain or TMJ, blue X mark area will be very sensitive and tender. So by squeezing this area, your third finger, and then going side to side. This is your TMJ, the jaw area. So by squeezing this area, you may have some pain relief on the jaw area. Large intestine 4, the meridian point, is a great point for jaw pain as well. You will learn this point shortly. Ear chart. You can focus on green and blue color area because it's neck and the middle back. Right between is a shoulder. So if you have a shoulder tension, you can search around the red check mark area and press it until you feel less tender and tight. Less pain means better circulation. You can use a red circle area on the foot chart to relieve neck and upper back tension and pain. East Asian medicine uses the concept of meridians. It's kind of chi energy pathway. For example, large intestine meridian starting from your index finger and goes to the next to the nose. Frontal headache is usually associated with digestion. That's why we use large intestine 4 to activate the digestion to relieve headache. As you can see the pathway, it goes to the lower face. It's an excellent point if you experience jaw tension and pain. And check your jaw tension and press on LI4, large intestine 4, and check your jaw tension again. If you do right, you will have an instant tension relief. Large intestine 4 is located in the green dot area. It's right in between. But since energy moves time to time, and please search tender points up and down to find the most tender point around the red-yellow area. A right way to apply the pressure is towards bone. Not this way, not this way, it's towards bone. UB60 to UB62 are the common points that I use at the clinic because most patients experience nape and upper back tension. To redirect and pull energy downward, I check the tightness and tenderness around the red circle area and apply acupressure or utilize the pain relief tools. It helps relieve occipital headache, which is your back of your head. There is an acupuncture point for stress, liver 3. In Asian medicine, liver controls the blood and energy flow. When you have a stress, liver 3 becomes tender and with pressure. Vertical headache is usually due to anger and stress. It's kind of upward emotion staying in the upper head. Liver 3 is an excellent point to check your stress level and treat body reactions from stress such as hypochondriac pain, indigestion, irritability, and sudden anger. It's between first and second toe, follow between bones. Where two bones meet, that's a liver 3 point. By stimulating red-yellow area on the left chart, you can redirect energy downward to relieve vertical headache. A gallbladder meridian flows through the side of the body, as you can see in the chart. When you have a temporal headache, GB41 is a great point to redirect your energy from temporal head to the foot. GB41 is located between fourth and fifth toe, following between bones, there is a tendon. It's just behind the tendon, that's GB41. You may feel like a hole. You usually feel a hole or a depression on acupuncture point. When you press, if there is a pain, you got it. You can apply the acupressure. If there is no pain, you don't need to give a stimulation. Here's a massage chart you will get in a toolkit. Nicely laminated. Forearm chart and hand chart. And here's an ear chart and foot chart and some acupressure points for different head location. Please watch next video, Pain Relief Toolkit, to know how to use tools with the pain relief formula. Be sure to follow us on Facebook, Instagram, and YouTube at Silver Lake Clinic to stay updated. Thank you for watching.